This is a discussion on the use of medications, particularly in Nigeria. As we know, when you are sick and your illness requires medications, that essentially most people benefit from taking medications to prevent them from dying from the illness in question. On the other hand, inappropriate use of medications can kill you, and it has other devastating effects in different organs. And sometimes it does more harm than good, particularly when the medicines are not prescribed by those who are trained to know both the science of the medication, the mechanisms of action, the the side effects of these medications, the medical indications of the medications, and how the medicine interacts with other medications, and how the medicine actually interacts with your body, um, both at the time you take it acutely and then long-term consequences or benefits of medications. Um, One of the difficult problems we have in Nigeria that we haven't been able to solve is the idea that a non-physician, nurse, healthcare provider turns out to be a patient, goes to a laboratory of his choice and tells the laboratory that he wants them to run the labs on him to find out what his diagnosis is. Most often than not, because of inadequate regulation in Nigeria and the greed of those who are selling these medicines and running these labs, they lie to you and tell you you have typhoid fever or that you have malaria. In certain circumstances, they will sell the medication to treat these illnesses that you don't even have to you, or you haven't realized that your mother or your father, your brother took chloroquine when they had malaria 20 years ago. This would then advise you in your own mind that you need to go and buy chloroquine. So you go to the bridgehead to buy either capsules filled with chalk that are by no means medications, but simple placebos. Or you buy things that are not medications meant for malaria. Even if you have it, you are buying something that is meant for hypertension or something that is meant for diabetes, because you don't know what the medicines are used for, and the people you are buying it from are not trained healthcare personnel. So they sell anything they want to you. I'll give you an example. When I was in medical school, someone in my village had kidney stone, and the kidney stone manifested itself by dysuria, pain in urination, and pain in his flanks. But he had no discharge, no blood in his urine that he could see, but it can be microscopic and he will not see it. He concluded, based on the fact that he had heard from people that when you have sexually transmitted disease, that you end up having dysuria or penile discharge. And so he concluded that he had to go to a chemist who happened to be someone with elementary school education, who owned a patent medicine store, an outlet from where he sells all kinds of medicines to the prospective buyers. So when he described to him that he had dysuria, he concluded that he had gonorrhea, and then gave him antibiotics for gonorrhea, even though what he had was kidney stone. How did I find out he had kidney stone? He had actually gone to a physician about 8 months prior when he had a similar incident or episode. They took an x-ray of his abdomen, and the stone happened to be one that was calcified, and they were able to see it on the x-ray and circled it with a black pen. So when I saw that x-ray, I saw the stone, then I reassured him that he had no sexual transmitted disease, but what he had was a kidney stone. So going to self-determine what medicine you need, where you buy it, can kill you. The side effect of the medicines, even if they are appropriate medicines indicated for your illness, by interacting with other medications can kill you. The side effects themselves can kill you. For instance, antibiotics can cause your kidneys to fail. Aspirin can make you bleed, right? Certain medications can cause your heart to malfunction. It can cause your liver to die. Therefore, inappropriate use of medications is usually not good for any patient. Going to your physician to get prescription for medication after the diagnosis is made is the right thing to do. Sometimes financial handicap may cause you to go to the patent medical store to buy medicine and go through this process I just described. Then it's not your fault because you don't have the money. It becomes the need of the general public or the community at large to make sure that people can afford their medications one way or the other. And this is where the private sector and the government can come in. But this is a different topic for a different day. But for now, we are dealing with taking medications that are not indicated for you and making decisions on what medicine you need without any medical training or training in pharmacy is playing Russian roulette, which can kill you. And so this community service is to discourage you from doing so and to also warn you that there are so many medications sold in Nigeria, particularly Bridgehead and other places, that are not real medicines. They are artificial concoctions. They sell to you and say this is medicine, many of which will have either devastating effect to your organs or kill you silently. And then when you are dying, your neighbor tells you that it's your grandmother or your grandfather or your neighbor who has invoked one evil spirit on you, and that's why you are dying and your legs are swollen, when in fact you are dying from the kidney failure, which the medicine you bought from the Bridgehead has caused you. So I'm appealing to you, to the best of your ability, to go to physicians to diagnose your illness and then get prescription for your illnesses. And hopefully this will save many lives.